Greetings, everyone, and welcome to Beyond Connections, rural Georgia's premier medical and healthcare professional new media network. This is MedTech Radio. I'm your host, Frank Baia. Today's guest, we're greeting Todd Perman, Executive Managing Director, Global Healthcare Services. Todd, welcome to MedTech.
Thank you very much, Frank. Appreciate that.
Well, Newmark Grubb, Knight, and Frank, even a partial part of Counter Fitzgerald, a company that's global, 300 offices, 5 continents, and obviously astute in realizing the momentum that's happening in the successive transformation of the healthcare industry to have one of the largest and most experienced healthcare real estate teams in the country. Let's talk a little bit about that part of the industry, and maybe even go into a little bit about the actual financing, acquiring, developing, and disposing of healthcare real estate.
Absolutely. Really the industry's changed a lot, Frank, and has been evolving quite a bit with healthcare reform, the Affordable Care Act, and certainly I consider that an evolution dating all the way back to the Balanced Budget Amendment in 1997. But we're in a process right now where the continuum of care is shifting, and it's putting a lot of pressure on hospitals to adjust their environment, which requires capital and which also requires cost containment and a lot of process decisions. And that's one of the major areas that we focus on. So it's finance all the way through to operations and cost reduction strategies, and really how they deliver patient care at the point of care where the patients need it.
Well, I think the layers and tentacles, is when you think about the obvious situation with healthcare systems, physicians groups, investors, and developers, that's complicated enough. Then layer that with estate operations and real estate operations and portfolios, and then creating long-term strategic plans. Complicated issue in the face of a normal economy, now in the face of healthcare reform. How has that affected this particular segment of the industry?
Oh, that's a great question. It has. Well, let me kind of give you my perspective of a hospital. The number one balance sheet item is their physical plant. It's typically they have a certain amount of capital, a certain amount of cash, but their number one balance sheet item is real estate, whether it be their actual medical office buildings all the way through to their acute care facilities, or whether they have ancillary types of services on an off-campus setting. But that's their number one asset in many cases. Their number one cost is always labor. Number two is very typically supplies. And we kind of looked at that as I was doing a lot of consulting throughout the 90s and early 2000s. That was really where we spent a lot of time looking at efficiencies in labor management, looking at cost reduction strategies surrounding their supply chain and those types of things. But the third largest budget item on their operational budget is physical plant and real estate. So and a lot of the supply chain and call it labor management have already been kind of maximized, or at least looked at and been effectively reduced as much as possible. So you look at the challenges of today's environment and you say, okay, well, if your number one balance sheet item is this class of asset, and you look at your operations, and between 12 and 22% of your operational budget gets spent every year on managing that physical plant and managing the real estate and managing and leasing space and doing what they do, it is a critical part of their operation. It's a huge component. And you take that a hospital, even call it it could be a rural hospital or someone even in an urban setting, may have 50 to $1 billion in revenue. But they're running that business on a between a negative and 5% margin. That's really the area of complication. So your question is a really good one. How does a hospital navigate what's all the challenges of healthcare reform in a normal economy, notwithstanding what's gone on in the last 4 years in the economy? So and that.
Well, and even in the face of technological evolution and all of the transitions of things like telemedicine and some of the assets that have got to be injected even into a physical plant.
Oh, it's huge. So take that to just give you an example. A hospital today is mandated by meaningful use clauses and all of the things to spend a significant amount of capital to improve their IT systems. and to adjust to the current environment. They also are really encouraged to implement electronic medical records and other types of things. Well, I spoke to one hospital recently who spent $250 million in capital. Like, that's a cash hit that they had to spend to implement EMR. Okay, where does a hospital get that amount of capital? Well, they have to look at their assets. They have to decide, well, what can we leverage and what can't we? You know, a lot of hospitals are leveraged by municipal bond debt. We actually spend a lot of time talking about that because we have a municipal bond analyst on staff through Cantor Fitzgerald. And it's key because you think about the entire capital structure of a hospital and you think about their core and non-core assets. And, you know, a lot of people in the real estate profession would say, oh, you should sell everything. Well, our strategy and how we really try to think about a hospital is they should really evaluate every step that they make. They're running a very large business with no margin for error and a huge need and demand for capital and change. So our strategy is to say, well, how do we dive into that and really help the facilities and the operations all tie together with strategy so that they're treating their patients as a manufacturing process. A diagnosis, let's say a cancer patient, is coming into the building on one end and coming out a healthy patient at the other end, right? And they're going to get reimbursed a certain amount, and that's the whole concept of population health. You know, you're managing the wellness of the population, and the entire and your listeners, a lot of them are living that every day. They're trying to figure out, well, how do we navigate that process when they can't really always tell you, well, here's how much it costs me to treat that patient.
Well, I was my mind was thinking right on that exact point in terms of, you know, dealing with access to capital. You got to deal obviously with some kind of plan for return on investment, right? I mean, is that primitive to say that? How do you project out 5, 8, 10, 12, 15 years with all of the transformation that's going on and all the government regulation?
It's extremely challenging, and that
and throw in the part about metro versus rural markets. How complicated is that? Is it the same thing, only different, or is it unique in itself in terms of that?
I think it's unique in itself in that you know, you might have a constrained market in an urban setting, you know, but certainly you have the challenges of keeping your patient population in your rural setting to get care, you know, and keeping the confidence of that population.
Sure, good point.
And I guess in my opinion, it's a huge tipping of the scales. It's a balancing act between, you know, serving your mission and then having contribution margin and running a business, right? So hospitals are all mission-oriented, at least the not-for-profit hospitals are. Even the for-profit hospitals are. It's a very thin-margin business no matter whether you're for-profit or not-for-profit. So the strategy has to be, you know, we're here to elevate care. We're here to drive value for the population. We're here to create wellness, and it's got to be mission-oriented. But at the same time, you have to balance the idea that you have some sort of methodology to measure, hey, if I invest this, here's my return on the investment, and here's how it's going to serve the mission better, and here's how we're going to drive value for our population, as well as, you know, the hospital, the employees. I mean, you know, the hospital CEOs today and CFOs, they have this burden. They're probably in a lot of markets, they're the largest employer.
Sure.
You know, they're driving.
Well, they're part of the economic development infrastructure that, you know, if you're going to grow your economy, if you don't have a healthcare infrastructure that allows for inbound investment to either have healthcare and health access to its people and or having, you say, centralized or decentralized manufacturing plants where there's employees. I mean, it may sound a little bit materialistic and not altruistic, but it's fundamental to the health, not only the healthy economy in terms of the people, but a healthy economy in terms of the economics.
It's massive. If you're going to drive and recruit actual business to an area, you have to have healthcare services, and you have to be able to deliver care and manage that population health. And that's what the trend and how I'm not sure that healthcare reform has driven that, but it's trying to. It was really a payer reform. I think now we're trying to drive at, well, how does healthcare kind of continue to reform itself, become more efficient, start accounting for a diagnosis and a process to treating that diagnosis with a cost structure in mind that they can survive and make money and actually serve their mission. And
basic question out of that overview, healthcare has affected the changes in in the actual delivery of the services and the provider environment, or has capital markets impacted that world?
Oh, good question. I think that it's a combination of things. I think the healthcare component is definitely the drive. It's got to start with the clinical, in my opinion, and driving the population health. I think that there's been a trend in the healthcare capital markets to see major investment, and as a flight to quality. If you just look at the healthcare capital markets on a global basis, last year, and I'll just use 2012 numbers just since they're a complete year, there was $22 billion raised for healthcare-related assets as an investment. There was $5.8 billion in healthcare real estate deployed last year. Our team was involved in a good chunk of that, but for all intents and purposes, if you look at that supply-demand issue, that's allowing. There's been a huge flight to invest in it, but not enough supply, and that's allowing some hospitals to create opportunities where they can leverage their non-core assets or other things, and that's a matter of choice. It's a strategy that some are deciding on and some aren't, and frankly, it's different for each one, and we run that. We spend a lot of time analyzing that process, what hospitals should do, especially when they have that need for capital and the need for demand. So I'm not sure if I answered your question.
Yeah, obviously it's pretty complicated, and I'm guessing unique to every situation, although a lot of it is, we say in the technology industry, the same thing, only different. I mean, you run into the same issues, whether it's occupancy cost or increased efficiency and all of those kind of things. But obviously, the approach has got to be know what you're talking about, analyze, do the situation analysis, and get all the information that you can, and then affect the findings and deal with the reality of what you're facing.
Absolutely. It's data, and you need to have all the pieces of data.
Wait a minute, it's not data anymore, it's big data.
It's big data, right? And a lot of people talk about efficiencies and lean, and how do we really implement lean processes, and then how do we maximize our expenditures, and how do we do those types of things. And in healthcare, it's taken a long time for those things to come to the surface, especially when it ties to operations. But we finally, I met with probably 46 hospital systems in the last 6 months. CEOs, CFOs, all executives, and we're having these conversations on a very high level with the executives that care about the entire operation, and are trying to drive change, because that's what they have to do in order for the hospitals to have any margin and to be able to provide care and continue to provide care. Otherwise, you're going to see a lot of hospital credit rating downgrades.
Sure. I don't know how they do it alone.
You're going to see a lot of challenges that were not expected, but they have to get lean, and they have to get strategic, and they have to use data, key data points, to make decisions, including finance, surrounding finance and operations. And if they do that, I think that those are the hospitals that will be the survivors, and the ones that don't address it with real strategy and decision-making tools and resources would likely, could be acquired, or there may be, other challenges that they face. So
okay, so in that environment, I'd be remiss in not asking the next obvious question, and that what are doctors going through today?
That is a great question. The physicians, have certainly seen the pendulum swing one way versus another. I can give you a few numbers, a few statistics, but physician employment has definitely become more the norm. I mean, you've seen major practices throughout Georgia sell to hospitals, and the trend, and I'd say on a national level, we've seen significant growth in employed physicians. So probably, I think the latest numbers I saw, 62% were employed by hospitals or some other payer. So it could be a Kaiser model, it could be a hospital employment structure where they're building their own ACO or some sort of organization to deliver care to their patients and to bring patients to the hospital. Okay, so you've seen a huge trend in that. The anticipation is that's going to continue to grow, and we saw some of that in the 90s with the balanced budget amendment, but we've definitely seen a trend for that to accelerate, and for big practices to monetize and build into a network with a hospital, and through some methodology, whether it's affiliation or employment or something like that. So I think you're seeing a trend in physicians kind of putting their hands up and saying, we can do better if we're all working together, serving the patient need. And that's the whole method to accountable care and how an ACO model works. It's that manufacturing process to have every specialist and every referring physician within a network that can drive that care.
Complicated perspective of an equally complicated environment when we talk about the healthcare market, healthcare industry, healthcare services. One of the things we're going to want to do, and I hope you'll accept our invitation, is to welcome you back again for another discussion with MedTech so we can mine some of these issues even deeper. Unfortunately, we're quickly running out of time, but I hate to put a burden on you to do a quick answer for this one because it's such a challenging and I think going to be an intriguing both question and answer. But what do you see as the future of healthcare, the future for providers, hospitals, and even the future for patients?
Well, that's a... You want a quick answer to that one?
5 seconds. No, I'm kidding.
5 seconds. Frank, I see, a huge trend in delivery of care at the point of care. I think that, and what I mean by that, I think you're going to see a lot more hospitals without beds. I think you're going to see a trend to have other places for people to go when they need care in a bed, like long-term acute care or rehab or what people are calling super skilled nursing facilities. So I see the continuum of care evolving so that you're not in a hospital setting all the time to get care. I think that surgery centers and the what I call a hospital without beds is basically an environment where you get all the hospital services, but they're doing it in an outpatient setting. Mm-hmm. So nothing, and that's where a lot of the cost of operations are for a hospital. You got all the labor to manage the floor and deliver medicine, and unpredictable things happen in that situation, that environment. So I see that as one trend for the hospitals. I think you're going to continue to see patient demand for access to care in more readily available environments, freestanding emergency departments, those types of things.
Stephen, time always goes way too fast when the discussion is really, really, really good. I'd like to invite you back, and soon. Great stuff. Stephen, thanks for taking time from your busy schedule to join us on MedTech today, and an open invitation to join us anytime you've got the opportunity.